the MC today. So at the Institute, we host events and publish information to help shape policy and practice and explore ways to promote high-quality, affordable healthcare and support healthy communities. Today's conversation builds on last year's forum on AI and healthcare, and today will center on the question of trust. So 2 years ago, Pew Research conducted a poll that asked people how they thought using AI to help diagnose disease and recommend treatments would affect outcomes. The poll found that opinions were fairly evenly divided, with 38% thinking that AI would lead to better health outcomes, 33% thought it would lead to worse health outcomes, and 27% thought it might have no impact either way. And another survey conducted last year found similar results, with 26% of people saying they felt optimistic about the use of AI in healthcare, 26% feeling concerned, and 27% feeling uncertain. These findings highlight some of the questions we'll be grappling with today on the future of AI in healthcare and the role of trust in that future. So at today's forum, we'll hear about exciting new AI innovations that are emerging and that have tremendous potential to improve health and healthcare. We'll hear the perspectives of different stakeholders on trust and consider how to build and maintain trust across the AI lifecycle. And we'll hear about opportunities to ensure that the benefits of AI in health care are broadly accessible. Across all these themes, our speakers will discuss implications for health policy. We've assembled some incredible leaders in health AI, and we're looking forward to today's conversation. We want today's conversation to focus on the topics of greatest importance to all of you here. And I want to thank those of you who submitted questions in advance. Our moderators and panelists have seen the questions and will be making every effort to help address some of those throughout the day. In addition, we'll have an exercise to help identify the questions that are top of mind for you now. And the IHP team will share those with our moderators as well. So it might be helpful for you to start thinking about those questions that you walked in with today. A few housekeeping items before we begin. I want to thank everyone in advance for adhering to our code of conduct and supporting a fruitful conversation with space for all different voices. To access information on today's event, there are cards at your table. They have information on how to connect to the Wi-Fi and a QR code that takes you to the webpage with the agenda and speaker bios. If you're using social media to share posts on today's event, you can mention us using our handle at KPIHP and hashtags like AI and healthcare AI. We are recording this event, so please silence your devices. And if you have to take a call, please do so outside or ask one of our staff members if there's a space that you could take the call in. Restrooms are located behind the screen wall and down the hall to the left. And in the case of an emergency, which we hope there will not be one, the exit is located right behind us, where most folks came in today. So I would direct people there in the case of an emergency. So with that, I want to welcome to the stage Dr. Vincent Liu and Mr. Bakul Patel for our opening conversation. Dr. Liu will introduce Mr. Patel in just a moment. And as both of you come up, Dr. Liu, I'll tell the audience a little bit about you. Dr. Vincent Liu is the Chief Data Officer for the Permanente Medical Group and Kaiser Permanente, a pulmonary critical care physician and a senior research scientist at the Kaiser Permanente Division of Research. He leads programs in using advanced analytics, data science, and responsible AI to improve care delivery and patient outcomes for the 4.5 million members of Kaiser Permanente, Northern California. Now I'll turn it over to you, Dr. Liu.
Great, thank you so much. Welcome to everyone for this. Very exciting day where we're talking about AI, innovation, benefits, and trust. We're going to be spending some time chatting with Bakul Patel. But I thought I'd just get us kicked off with a little bit of an intro. I'm going to start by describing kind of like what is AI, and I'm going to use a simple version, and I think Bakul will go into more depth. I think of it very simply as breaking down the terms artificial and intelligence. Intelligence is the capability to achieve complex tasks, and artificial is non-biological systems or machines. So in my construct, in this simple construct, artificial intelligence means machines that are able to accomplish complex tasks. And we've come through a number of epochs or generations of AI. I would say the reason that it's come to the forefront over the past couple years is because we've come from a place in which it was narrow, defined, trained, so that every AI instrument or tool really focused on one objective and could do that extremely well, whether that was predicting an outcome or evaluating one modality, like a chest X-ray, for example, to identify a hidden feature, like a pneumonia or a device. But the place that we've come to is where AI is now broad, generalizable, even multimodal, where it can integrate lots of different types and modalities of data, and is not trained on a specific task, but has shown facility with being able to accomplish, again, complex tasks that it wasn't trained on. Importantly, in KP, we also use the concept AI as augmented intelligence. And so, again, the reason we think of it as augmented intelligence is because it places people, patients, clinicians, and communities rather than algorithms at its center. And for today's conversation, the trust imperative, I think that's incredibly important to remember, that we're thinking about AI and its impact on some of the most human needs that we have. Healthcare, well-being, the ability to live a life that's fulfilling and where we're able to increase health span. Now, when it comes to AI and healthcare, we'll talk about this all today. There's many, many diverse applications. There's things like automation in the back office, improving, some of the administrative aspects of care. But I think what's really exciting is the opportunity for AI to improve things that really matter to patients, to clinicians, and communities. Earlier diagnosis, new drug discovery that can fundamentally change the course of disease, precision medicine, and information synthesis. So pulling together all of those diverse pieces of data, some which are very complex to piece together in a cohesive way and do that quickly. And then finally, to use all that information to generate new insights that help us improve that healthcare partnership that we're in together as clinicians, care teams, patients, and communities. How is KP using AI today? Well, really, AI is part of our objective to achieve our overall mission, which is to deliver high quality and affordable care, to improve the health of our members and the communities in which they live. So AI is really part of that, but again, aligned with our overall mission. I'll give two really quick examples. One is something that we put in more than 10 years ago, Advanced Alert Monitor. So we knew that a small percentage of patients in the hospital deteriorate and end up in the ICU. And these patients are often giving off signals that they're deteriorating, but they can be missed in the course of care. By using a predictive algorithm in order to stitch those things together, we can surface those insights earlier, bring together a care team that does a reassessment of a patient, and even ask fundamental questions, like if you were to worsen, would you want more aggressive or invasive care? Because up to a quarter of our patients in the hospital do not want life support therapy, do not want to be resuscitated. So really, again, focusing on that human-centered, patient-centered orientation in order to improve care. But with the use of that tool, we've seen that it's saving 500 lives per year across our hospitals in Northern California. Another example is in the generative AI space, which is the ambient AI scribes. That's really taken the industry by storm. Simply put, there's a microphone on a smartphone, protected and private and secure data, where it takes the role of taking notes and synthesizing a conversation between a physician and a patient. What we found is that it improves the physician-patient relationship. Physicians spend less time locked in on documentation in the computer. It improves burnout. The industry has shown that, leading to a more sustainable workforce. And in aggregate, it saved our clinicians tens of thousands of hours in time that they spent outside of work in documentation. So those are some of the ways that we're thinking about AI, augmented intelligence, as helping to support our mission of high quality and affordable care. And now we're going to hear from Bakul Patel, who is currently the Senior Director of Global Health Regulatory Strategy for Google. And he focuses on building a unified digital health strategy aligned with global regulatory needs, with a vision that Google will help to realize the potential of digital health to herald a new era of healthcare. Importantly, Bakul spent time in foundational ways at the FDA as the Chief Digital Health Officer of Global Strategy and Innovation, as well as the Director of Digital Health Center of Excellence. He's coined important concepts in the field like software as a medical device and other aspects which have become central to the way that we think about regulation of AI in healthcare. And with that, I'll turn it over to Bakul.
Thank you. And first of all, thank you for having me here, and I'm really honored to be speaking to you all. I wanted to just tell you how excited I'm about where things are going and where things can go. Of course, we have to be guarded with, how much do we trust? Can we detect those things that are wrong? Technology is not perfect yet. It's getting better by the day. I just want to sort of add to what Vince just talked about, the epochs of AI that we're thinking about. Let me add like a slightly different perspective. We used to think about experimenting and then coming up with some sort of formula that will be programmed in, and then the next phase happened with machine learning, where we basically took our experiences and documented experiences and data that sort of came from that and turned that into something that we can repeat again. That's what we call the second epoch. And the third epoch is generative AI, that basically ingesting everything that we have ever written and trying to find connections between what we could say. Nobody, I think, at least the people I've talked to, knows how it comes up with coherent statements that we all like to see from these tools, because the technology is so unexplainable to some of us. So I think this is where you need to sort of understand where things are heading. Things are a little bit unknown. We cannot anchor on things that we knew that we need to know everything about technology. That's the caution part, but the promise is also incredible. We went from a linear inquiry structured way of looking at things to more of a curious inquiry that where we can actually ask the things that we are thinking, and we can get this answer. And if some of you may have used Notebook LM, where you just put a document in and you just ask questions in the document as you're reading, as opposed to reading the document. So it completely flips the script on how we interact with content and how we interact with information. I want to share a clip that sort of exemplifies this a little bit, and a journey of a dad, a recent dad, and it's called the Thomas's story. If you guys can cue up the video.
I had no idea what Alexander disease was. Typical life expectancy is 5 to 10 years. There's no treatment, there's no cure, there's nothing we can do. And yeah, I fell to the floor. You mean you have all of the emotions. You're angry, it's unfair. What has he done? Like, he's just 7 months old. I mean, I love him so much. And to just accept the fact that, we'll just wait and see and do nothing is, that is not an option. There's always something you can do. The first thing you do is search, like, what is Alexander disease? Because you have no idea. okay, Alexander disease is caused by a mutation of the GFAP gene, which makes a GFAP protein in astrocytes. And then you're like, okay, what are astrocytes? So you start hearing all of these words like myelin and oligodendrocytes. Like, I don't even understand the language. When Gemini came out, the really lovely thing is that it can read PDFs. So it can help me analyze and understand scientific papers that are incredibly dense, could be 20, 30 pages of technical language. And I can go, just summarize this for me, please, and help me understand. Then I get a very helpful top-line summary of what this talks about. I think that's where I started to get a bit of a sense of what was going on. I understood, I guess, that there are some parallels between Alexander disease and Alzheimer's. And there's not that many people working on Alexander disease, but there's an entire army of pharmaceutical companies, research scientists, and everyone in between working on trying to fix Alzheimer's. You realize that suddenly there is a bunch of people out there who work on things that they themselves don't know might be really relevant to Alexander disease. So I can literally take all of these papers and I ask Gemini, can you help me understand this paper on Alzheimer's? Thank you. Can you help me summarize this paper about Alexander disease? Can you bring the two things together, please? How is this relevant in that? Oh, okay, this might be relevant. Hey, Gemini, can you help me write an email to the author of this paper outlining how their innovation might be relevant in Alexander disease? And it's like, sure, can. I literally send an email on Friday late afternoon. Monday morning, I get an email back from this professor in New York.
That email really caught my attention. I have to admit, we've never heard of Alexander disease before. I emailed him back saying, like, I think this could potentially be something that we could test.
And now she is working on Alexander disease. They're literally in the process of arranging the experiments. That is my...
So this person took the curiosity to the next level and actually started an initiative for researchers who were already working on adjacent disease and sort of make that. So to me, this is sort of the way of putting power to patients, as Vince was talking about, directly. In this case, a dad, an engineer at Google, didn't know anything about Alexander's disease and able to turn that into something in a very curious way. And that's the power of technology. I want to show a really quick, a second dimension of a program at google.org that was started for veterans who are experiencing suicides, or actually we saw that many veterans commit suicide. So taking that and turning that into a solution that can help those veterans was something that google.org did. So can we share that video?
Well, my buddy Ashton died, and so now I'm kind of bummed and not really wanting to be around anymore. Oh, wow. I'm so sorry to hear that. I'm here for you if you need someone to talk to.
I really appreciate it.
I really appreciate it.
Personally, I have lost over 50 friends because of the simple fact that they didn't have anybody to pick up a phone and listen to them, hear their outcry. Technology like this just opens up for there to be dependence, on other individuals.
Having that communication opens the door for the healing process.
As we launch Home Team, every part of the product has veteran hands on it.
Everybody really came together to try to build something here.
I really hope that we have made a dent in reducing stigma among service members and veterans.
We're not just creating a product that serves a need, but that is connecting people to other people.
The big hope here is to save lives.
So in this project, AI was used to train veterans to talk to other people, to connect with the community, to make sure they have the support in the way they wanted support and not just prescribed one way of thinking. For me, this technology that we're entering into is opening up doors that didn't open before. We're no longer thinking about, how should I understand this table of data that we have in front of us? Instead, we can ask curious questions. I have many other examples, but I think to be very germane to, in a hospital setting, a simple example was nurse handoffs. How can we make that even simpler? And make sure that the transaction that happens between shift 1 to shift 2 and shift 2 to shift 3 is seamless and nothing is lost in the transition process. And I think those kind of solutions will actually bring value and bring trust before we get into the diagnostics, using generative AI or therapies using generative AI. There's a lot of discussion around mental health today, and we know these tools can actually create harm, can actually also, if positioned right, can actually create value, just like we saw in the veterans case. So I feel like there has to be a balance as we move forward. And as we think about policy, we need to start thinking about what is the right levers, what are the right guardrails, how do we train people, and so on and so forth. Maybe I'll turn it back to you, Vincent, just we can have a conversation around, where should we go from here, and just discuss what are the trust issues and what are the sort of opportunities that we can sort of leverage.
That's great. Let's go ahead and do that. I'm blown away by the surfaces that Google has in its kind of entire umbrella, not only within Google, but within the larger enterprise. People may think of the search bar, but we're also talking about YouTube, we're talking about wearables, we're talking about health-specific companies that are even at the basic or translational stage. So across, and when I looked it up, I used Gemini and looked up how many health-related queries does Google, is it estimated that Google gets every year? And they estimated the number in the trillions.
Yes.
So when you're thinking about a surface that's that broad, not to mention partnerships that you have with health systems and health-specific companies, how are you thinking about trust? And, kind of aligning global regulatory considerations across that really, really diverse, heterogeneous, and simply massive scale surfaces?
Yeah, I think what attracted me after FDA at Google was its mission to help everyone everywhere around the world was sort of the key driver for me to join Google. And when I got there, it was sort of important for me to understand, how does that happen? And then I dug into this. And to answer your question, there's a lot of work that goes into making sure that the information that is provided to the user when they're asking a query is grounded in something tangible. We often anchor ourselves on the WHO guidelines, we anchor ourselves on health systems guidelines, and make sure that those are surfaced first. That is not blocking other things, but also surfacing the first relevant things. And that happens across search, that happens across YouTube, it happens across other surfaces, like even maps for that matter. Finding the nearest facility is actually a feature that sort of exists today. One thing I would say, again, going back to the numbers, the trillions of queries that comes across the world, what we have seen shift is with the advent of generative AI and inclusion of that into our products in AI overviews and our AI mode, we've seen people ask longer queries, more conversational queries, as opposed to just keywords. And we all know, I'm pretty sure there's a diverse level of feedback you'll get from a regular search if you didn't use the right words, if you didn't know how to frame it right, and you get different levels of responses back from the search. But now, with generative AI, I think that has sort of increased the access of information to many people who are just able to just talk in the way that they would normally ask a curious query to another person. And that is sort of the power, I feel, that's sort of happening. And the question about how do we think about, in generative AI space, about making sure the health information is surfaced in the right place, in the right way, being sensitive to the fact that, there is a downstream effect of a user undertaking something that's shown on a screen and taking action or inaction on whatever the next step in their health journey is supposed to be. We take really, really good care. In fact, my team and the health team at Google spends a lot of time making sure the models are trained and there are guardrails in place that don't allow people to sort of assume that's the only thing that they have to do or think about. And that is because it's a general purpose tool. It's a general purpose query that people are making. It's not specific for a particular, like you said, not diagnostic or not specific, like how do I treat X or how do I manage Y. I think it's just about information. And that's kind of how we think about internally.
Mm-hmm. I'm wondering about whether there's a tension between kind of the pace of innovation and then making sure those guardrails are in place. Feels like with the pace of change in AI, everyone is kind of building the plane as they fly it a bit. And so how do you think about that, particularly given the potential impact of AI for benefit? You know, the information asymmetries and other kind of, things that have blocked patients from getting engaged in their own care or have blocked information from rising to the surface where it can then be, acted upon. How do you guys work through some of that tension?
So I think Google is a consumer-first company. So the way we think about this is consumers need to get access to the best information. In fact, there is a mandate for across Google to make Gemini the best for health in period. And that sort of gives a mandate to everybody working at Google to start thinking about users, which is the center of the universe for Google. And think about patients and health users, very different bar to start thinking about it from that perspective. And what we have done is making sure that the empathy that the responses come back with, the way it's proposed, when the response is proposed, is actually matters quite a bit. And it's not just about, when somebody asks a question, I have X, my knee hurts, what should I do? It's about explaining why, and usually in care, as you know more, there's more than just what the person asks, right? That you have to look at what the person is really feeling, what did they do in the past, et cetera, et cetera. And I think that missing piece is totally considered in the response that was given by the tool. And we're getting better at sort of making sure that we're understanding the user's intent and also sharing with them some of the things at a very high level in terms of like, look, you need to think about this as an information tool set, that you should take that into consideration and go talk to your doctor. You'll see tools come out by various players that's going to make the interaction between, before the encounter happens with the doctor, the information that the patient needs, information that the doctor needs, and that friction will be reduced with this technology. And I feel like that's the up level that's going to happen in this space.
So we've talked a little bit about Google's interaction with users and the users being kind of folks out in the communities. What about partnerships that you have with health systems or clinical groups? It feels like there's a lot of work happening in that space. Do you have a different type of regulatory schema or guardrails in place that differ from kind of your general purpose services?
Yeah, I think, Google, except for a few areas in the Fitbit world and the Google health hardware world, we don't intend to sort of make regulated products. We are great at enabling others to sort of make products, may it be in retail, maybe in automotive, maybe in healthcare. So I think the way we sort of build platforms is kind of what we are good at Google. So our strategy always has been, how do you get people to build those vertical answers in the most sort of easy way? So for example, I'll give you, this is not new. Many years ago, actually even continuing, Google has the biggest contributor to open source community. We put out a dermatology model that's a foundation model. Instead of training the model from scratch, you can train the model using this foundational open weights model to reduce the time it takes and the data it takes to train the model for that particular thing. We did similar things for mammography. We did similar things for diabetic retinopathy and so on and so forth. There's many other things sort of gives people, and the Google research actually spends a lot of time thinking about how do we enable people to sort of not struggle to the first 8 miles and only worry about the last couple miles.
So we've talked a little bit about the epochs of AI, how we've gone from more narrow, trained, defined objectives, and then now to more broad, generalizable.
Yeah.
You've actually written about kind of the concept of regulation with clinical Gen AI and how we may need to reframe the way we think about that. Would you talk about that some?
It's controversial, I'll just say it up front. And the fact that I say it's controversial is because I couldn't think about, spending about 14 years at FDA, I couldn't think about another way to sort of look at this generative AI as a tool that is almost getting closer and closer to mimicking intelligence like we as humans have. I'll just give you a couple examples. It's kind of, tongue-in-cheek, but I'll say, humans also hallucinate, so does this AI. We also make up things, so does this AI. We can't really tell how you came to an answer when you ask a person because they have connecting the dots in their head and experiences and the learnings they have over the years. It's exactly very similar to what this generative AI is doing today. We really can explain in a simple way that humans can understand what goes on with this large language model, especially when you think about trillions parameters, which is like trillion powered equations. We won't even fathom what that means, right? Even if you spend a lot of time. And then you start thinking about the next epoch of AI, which is folks are talking about AGI, which is...
Explain what that is.
Oh, I'm sorry. Artificial general intelligence, which is supposed to be a self-learning model that is not trained from what has been thrown at it. But it's, as humans, we are going to learn over time. And there's a bunch of papers written in the scientific communities that talk about the current LLM models are only going to take us this far. The next generation of models will actually take us to a place where it'll be just like human brain. We absorb things along the way. And when that happens, I don't know when that's going to happen. Some people predict 3 years, some people predict 5 years, but it is going to happen since people are working on it today. As we think about intelligence, and going back to the paper question, I think there's a couple things that current regulations or current structures don't quite work. Knowing when to put a thing in the market requires us to understand when good is, what good is, which means we need to know what measures to sort of measure it with, which means we need to have the metrics all established and standardized, and we all understand, we can all agree that's the right metric. With Gen AI today, I don't think we have that. We don't know how to measure empathy, tone, and there's probably the academics in the world probably go like, yes, we can do this, but can we really? I'm not sure. Can we actually standardize it? Probably not. So I think the first threshold of knowing that we can send something to market because we know it's good and doesn't hurt. So we have to get uncomfortable with the non-preciseness of this. So that's number one. Number two is when we see something go wrong and when things actually affect people when something goes wrong are two different distinct events in time that may happen. I'll just say it one more in a different way. When something goes wrong and the symptoms that shows up, the cause of it may be in a different place at a different time. That connection, the causal relationship of when something went wrong, finding what went wrong, is going to be very different. And because it's a system that we think about. So that's the second thing. And third thing is, how do we start thinking about what is it meant for? And we are looking at this technology that's based on large language models that are going to be verticalized for radiology or cardiology or other things. But the foundational will be very same. Then we'll have the small differences. So how do you sort of understand what goes in, what goes out? And we just don't know what inputs look like, what outputs look like, and level of control that need to be put in. So we have this entire system that we currently know is questionable, even from a liability perspective. Like, who should we hold liable in this entire chain of things? The current systems rely on one person building it, one person liable, one person responsible. And I think the systems approach today does not, with the technology that we have in front of us, don't quite allow for that. We can, of course, force fit a bunch of things, may not actually matter. So with that in mind, the paper I wrote last year was basically saying, can we think about this as how we, quote unquote, regulate humans? We send them through schools, we take some exams, we monitor them along the way. Even working professionals that, later in their career are still evaluated every year by their bosses to understand whether they're performing. And if they're not performing, they're actually penalized, and so on and so forth. So I think there's a structure that we know. I don't think we have the threshold established for that structure. We need to, I would say we should work on those, because if we were to send an LLM to a USMLE test, it can surpass what humans can do today. But is the test made for humans should be the same test made for LLMs? Probably not. So should we think about that separately or differently is kind of what the paper sort of proposes. And that was an initial thoughts on the paper that we wanted to share to get the conversation going. I think we need a systematic approach to a systems-based sort of solutions that's going to be in front of us. And I'll leave you with one thought, right? I think it's going to be important for us to start thinking about observing failures as opposed to reporting failures. We know there'll be many eyes along the journey of the use of this AI that can provide insights into whether it's working or not working, as opposed to just one person or one entity or one organization knowing. So I think that is going to be really, really important to sort of consider as we move forward.
Great, thank you. And that kind of fits with my, I use this kind of concept in my head of AI moving from being a tool to assistant to a colleague.
Yep.
And how does one judge a colleague and what their proficiency is on certain skill sets is very different than, saying that we're going to evaluate, the precise, use of that tool.
Exactly, yeah.
Okay. With that, we're actually going to turn this time now to the audience to make sure that we're hearing your questions both for this session as well as for the sessions that we're having throughout the day. So we're going to have an interactive time at each of your tables. So for those of you who are not yet at a table, feel free to come and sit at one of those tables. And what we want to do is really make sure that the questions that are in your minds, at the top of your minds, are brought to bear on this conversation. So first, I think there are either index cards or notepads at each of your tables. And what I'm going to ask you to do is just take a minute to individually write a question, both for Bakul, for our other presenters today, that's at the top of your mind related to AI innovation, benefits, and trust. So go ahead and take that time to do that now. All of you. Okay, now what we're going to do is actually interactive at each table. We want each table to essentially agree on the most pressing question, the most interesting question from your tables. So for the next 15 minutes or so, what we'd like you to do is work together with your table. Start off by introducing yourselves to one another briefly, and then also describing what your question is. And then together as a table, coalesce on kind of one, again, the highest priority, the most interesting, the most important question from your table. Folks from the Institute for Health Policy will be circulating to answer questions or to help you, and we'll be collecting those and make sure that they're part of the conversation that we're having here today. So go ahead and introduce yourselves and begin thinking through that question. All right, everyone. It looks like we're collecting some of those questions. Hope you had a chance to interact at your tables. Before we bring some of those forward, I wanted to ask Bakul about what he sees in terms of the context of the U.S. versus the global regulation. We've seen from the president, the AI action plan, that healthcare is one of those domains that has traditionally been too conservative, behind on our ability to deploy AI, and then also even the concept of a try-first approach.
Yeah.
But we're actually in the U.S. situated in a spectrum of regulation around the world. Would you describe kind of what you see as how our regulatory environment compares to other countries and what risks and benefits that may have for us in over the next decade?
Yeah, let me give you a little bit of a bird's eye view of where the world is. I think U.S. is to be the most stringent, well-respected in the world for regulations. And somewhere in the last 15 years, it sort of took a very pragmatic approach, at least from the FDA perspective. And then the EU AI Act happened, and we all know, GDPR happened, we all know, where EU sort of in the world became the first, most rigorous, most burdensome regulatory infrastructure. Then you have the other parts of the world where the meeting the patient needs and user needs and patients in the healthcare journey was a challenge from get-go. So I feel like to your point, Vince, I think this is a spectrum about how much regulations, where it's applied, and so on. My perspective, I've been talking to folks in a few countries. Some countries have started thinking about how do you try first before you regulate, as opposed to regulate before you try. I think we are squarely in the middle of that pack, as in U.S. There are certain countries on the other end of the spectrum where they're thinking about regulations, or they have existing regulations that they're going to feel like that's important to protect some of the citizens of their countries or their unions. And then there are countries, I'll name a couple, are well poised, controllable in their own sense. They're smaller, like Taiwan, like Singapore, even the countries in the African continent are thinking and even the Middle East, are thinking very proactively because they don't have anything to break down. They don't have any infrastructure to take down or rebuild from. And I feel like they are actually in a place where they can try and then figure out what the regulation is adequate. I think we are squarely in the middle in the US. The folks in the EU, even the EU AI Act has happened. Even the states within the EU Commission or the Union are actually starting to think about, should we be trying first? So I feel like we are squarely in the middle of where AI will be regulated. I see the global trend towards this journey about allowing technology to flourish before we actually start actively regulating. So that's kind of my sense. I think, I'll say this out loud, I think what I'm noticing, every country is thinking country first in terms of we need to be first in this race, this proverbial race. I don't know what they're racing, but they're racing into making sure that technology is available for their patients and the users of their country. But I hear every government trying to we want to use AI to enable better healthcare for our citizens. That has been sort of the consistent thing that comes across. When I talk to even the member states in the European Union, I hear the same thing. But the law says something different. But that's a different story. I think they'll figure it out themselves. I think you've seen the same thing in the AI action plan that this administration has put out as the same kind of underlying tone of making sure that we are enabling or leveraging this phenomenal technology for the future of healthcare.
Great. Okay. I'm going to just start reading here. Bakul, you mentioned liability. How do you view liability in AI agent interaction with patients? Is the conversation or query medical advice in the same way as a physician consultation? If a general AI radiology system gives a wrong diagnosis, who is liable?
So
Easy one for you.
Easy one. The general radiology diagnosis is actually regulated today. I mean, plenty of companies make this radiology software that detects things on an image or diagnoses certain things that are happening in an image. The AI can see. That is actually not the interesting question. The interesting question is when medical advice is given, just mimicking a care provider, where's the liability? I don't quite have an answer for that because we don't have the American Medical Board sort of regulating some of that stuff. And this is my point of the paper I published, right? I think we don't have infrastructure or systems in place that shows, oh, you're allowed, or this application is allowed to give advice, or this is not, because it hasn't passed this threshold. I don't think we have that yet. I think we need to create that. Others will be in this constant struggle for finding the person in the dark, and we won't find it.
And do you think partnerships with organizations like the board, professional boards, or the American Medical Association or others is going to be important to getting to that place?
I agree completely. I mean, we have to. I don't think we have a choice. At least from my very biased perspective, I would say we don't have a choice to not engage the non-traditional people in the healthcare systems, the non-traditional regulatory folks. But they are, in the way, providing some sort of assurance along the way for people when they're providing care. Just AMC, for example, could be a player. Joint Commission could be a player. EMA already has things that they can do. So it's the role that we have taken for granted. I think we need to pull them into this conversation. Otherwise, what we'll do is we'll not have the right infrastructure in place.
Yeah. And let me also include the certifying boards for nursing professionals and therapists of all kinds. The allied health professionals, the entire care team.
Yeah.
Okay. Excellent. What level of explainability and human-in-the-loop oversight should we maintain even as AI becomes a colleague?
That's fascinating. It's fascinating because I actually, just last week, I was at a conference and I was just debating this with somebody. And this person just reflected back to me like, how about if we stop talking about AI in the loop and just, humans in the loop and just talk about AI in the loop? I think that's where we are. Like if we start thinking about AI in the loop, it just puts the right framing. I love that because I said I'm going to use it and use it forever because I'm going to stop using human in the loop question. I think if we don't think about it as an AI in the loop, we'll be missing out on things that we don't normally sort of think about. I missed the first part of the question.
What level of explainability and human oversight should we have?
I'm going to be really controversial now. Explainability is made for humans to understand what the AI is doing. Now, you could ask another human to do the same thing, and you could probably get a reasonable answer. Is that what we think about explainability with generative AI? I'm not quite sure. I think people have various degrees of understanding or expectations of explainability. I think it's completely fair to say, it's explainable because it ingested this amount of data, this type of data, hence it sort of matches the pattern of XYZ than the data that was trained with. That is explainable. I can understand that. But when you ask about explainability for generative AI, it's a very different question. You really can't explain it that way. So you have to sort of think about, now you'll see pretty much all the AI tools have a thinking mode. If you guys haven't seen it, if you're curious, click on the thinking mode. It actually tells you what it thinks. To me, that is explainability. So and that is just recent, right? It didn't happen 8 months, 9 months ago. It started happening, recently. I think this is what will happen for us. So I think we're going to continuously try to sort of understand why that answer was given and why it was sort of proposed in that way. And then if you think about it from that perspective, then we are getting away from this. We need to understand every detail of how the answer was coming to. I think that is less explainable anymore than actually just understanding what thinking went into. So I think we are going to sort of see this evolve as well as we start going more and more into generative AI space.
And just going back to the former point, Bakul, like, fill out for me the AI in the loop concept. Like, do you mean where does AI fit into a human process today, or do you mean AI as the arbiter of or judge of a process that's going on?
So I'm framing this. If you think about just human-made processes for humans, we made how to interact with another person, pass this baton over, and the baton takes over. And now we have AI in the loop that can sort of fill in some of that. The nurse handoff was a very simple example. Just think about it that way. But if you think about every process, every organization, every healthcare interaction it's made for humans by humans. We'd never thought about made by humans with AI in the loop. And when we start leveraging agents, for example, and you mentioned that, you start sort of giving that autonomy of go search this thing and come back with an answer, or go query this part and come back with an answer. And it's going to be an equation that comes into play when I'm going to make the final decision. So I think the decision points and everything, all the things that we as humans don't really like to do or find it very tedious, is going to be that AI in the loop sort of process. And there may be some things that are low level of decisions making might be just handed off to AI. But there may be a place where we need to make the critical decisions. We make to make the most of the decisions. And I think the decision power may still be there with the humans.
And I think you're speaking to extract value out of AI, it's going to have to change the way we work.
Yes.
Rather than just be bolted on to existing processes
exactly.
today,
Yeah.
right? Because that's only just going to,
Yeah.
it's probably not, we're not going to be able to get the true value for human health
Yep.
and for the way that we can deliver care
Yeah.
Without changing some aspects of how we work.
Yeah, exactly.
Okay. How is Google preparing for the future with patients having their own health data and wanting to share that with Gemini in ways that are privacy preserving and protected from discovery?
There's a lot of very deep thoughts going on currently at Google, very much so. And it's top of mind for a lot of people at Google. In fact, privacy is one of the key ingredients. I mean, if you look at the number of people who work on privacy in Google, it's mind-blowing. It's not because we just thought about it today. I think from the days of search and YouTube and maps, that has been top of mind. There's plenty of people who think about models trained with de-identified data is like the key foundation as we think about. Now I think we're getting into a space where it's going to require some more further thinking when we start thinking about when models start to have memory, it retains context. We are actually, you'll see some things that may have already, you guys may have seen this already. There's a personal health agent we are sort of trialing out for people where it's basically like in your domain, on your phone, on your device, maintain the information. Now you will see things transition to on-device LLMs built on your phone, etc., in your sort of control. So you'll see this evolve over time. We are very actively in that space today, and it's very much top of mind. And technology is also growing at that exponential space where when the models have more in your account, and when you log on to Gemini, you have your own control over your data. what is it? What are you exposing to? It's not going back to the model. It can't, because models don't learn that way yet. Eventually, maybe it's your personal model happens. But I think that's the challenge and to be seen as we move forward.
Just to follow up on that, I mean, within the healthcare domain, there's regulations like HIPAA.
Yep.
But then once data leaves that environment, they're not under one single umbrella, right? Like so, data security, privacy varies according to different whoever has the data, like that de-identified data or whatever. What do you see as kind of the right innovation in that space from a regulatory standpoint to preserve that privacy and security?
I think enterprise solutions where your enterprise hospitals or healthcare systems can domain out their own enterprise, and then anything happens within that domain should be still under the HIPAA sort of umbrella, right? I think I anticipate we need to start being clearer what those boundaries are. I'm not an expert in HIPAA at all, but the little I know, I think as the definition of business associates may need to sort of be clarified as we move forward. Which data is available for models to use. And this may be another example of AI in the loop kind of conversation, where when AI is in the loop, what's that business associate transaction that needs to happen, agreement needs to happen with the LLMs. And I'm thinking out loud here, but I think this is a place that we probably need to start observing and monitoring and seeing whether we need to sort of provide clarity. I think lack of not being proactive, we might actually be finding ourselves in a place where we don't think we need to be from a privacy perspective. And on the other hand, I think I've seen examples where people are throwing at personal X-rays and images into public domain tools. Like, not quite sure how that is handled, but the tolerance of the public is also changing over time. And we need to just be aware of what that tolerance is. I don't think the rules needs to be so stringent that doesn't allow people to do it. And if those mismatch happens, we'll find a short circuit or a bypass for users to sort of take control of themselves.
Okay. What are 3 strategies to overcome biases in healthcare AI? How are healthcare systems tackling that issue now?
I know I've been talking a lot about generative AI, but I think let's just put that aside for a second. I think there's, at least just from my perspective, I think there are 2 fundamental issues for biases. One is availability of data, diverse data set. 2, participating in providing the data set. So it's not just things are not available, but also people don't participate in providing the data. So there's these 2 factors sort of get us into a place where developers and innovators can't really break that barrier unless there is like an openness in sort of making sure it's value added to the table. So in my mind, I don't know about 3, but I'll tell you 1 would be really helpful. If we start incentivizing patients and users by not giving them few cents on their data, but also giving back value of how the data was used, how that data was actually advanced, whatever that was advancing, either it's cancer research or something else. I think that feedback loop, I feel like it's missing for a lot of people. And if we start adding value there, you're creating an incentive structure for people to share more. They can decide to share in the right format, in the right way, in right constraints. But I think that if we start unleashing some of that, I think we may actually be in a better place. But right now, there's nothing to give back value for anybody. In fact, some of the value is being held by people who think they have the data. And
related to that, I think one of Google's missions is to organize the world's information, and in that way make its tools available to a very, very diverse set of people. And how do you see that kind of that value proposition, returning value, or making sure that end users are deriving value and thus willing to participate in some ways in contributing to those data? How do you see that playing out, given that you've already overcome some of the traditional limitations to data access or insight or information insight?
Yeah, I think this is the big difference in where Google has been in the consumer-facing, providing information, and then the healthcare-facing. The healthcare-facing, right or wrong, we have HIPAA, and there's protections for personal health information privacy. That has been the divide for consumer technologies to sort of say, we can connect those two dots. I'm not sure we will be able to connect that, or I don't know, I haven't thought about it enough to say, let's connect what we've learned in the commercial world into the healthcare world. I'm not quite sure we've made those connections yet. I think you raise a really good point. If we were to do this, we've, not just in Google, but just the advertising world have learned quite a bit about how to engage people in their shopping experience. Why can't we do the same thing for the healthcare experiences? So I feel like there's lots of this science and connecting of domains that can be happening. I think we need to bring, we in healthcare, I keep saying, we in healthcare, not we in Google, we need to bring other people's perspective and learn from other aspects.
Great. Okay, it looks like we've run out of time, so I'm going to end us there. Thank you very much for your insights, Bakul.
Thank you so much for having me.
Thank you, Bakul and Dr. Liu, for all of those great examples of AI innovations and thinking. I have a lot of notes scribbled here around value and feedback loops. So there's so much that we learned from that session, so thank you very much. And I do appreciate the perspective of all of you in the room and going through the exercise to identify, I think, really fantastic questions for our speakers today. So a huge thank you to all of you for participating in that process. So we will continue to explore trust in our next session from different stakeholder perspectives. And I'm going to ask our next panelists, Dr. Jain, Dr. Cordovan, and Dr. Nundy and Dr. Tripathi to come to the stage in about 10 minutes. And we will be taking a 15-minute break. So if folks could please be back here at 11:05 to get started, that would be great. So thanks very much. Enjoy the break.